And I would like to go to the next speaker, and the next speaker is Dr. Kimonis. And Dr. Kimonis is professor in the Division of Genetics and Genomic Medicine of the Department of Pediatrics of the University of California, Irvine, and Children's Hospital, Orange County. And a mouthful, but welcome to the floor. And your presentation is on substrate inhibition, but it's shown over here. Yeah.
Thank you very much. Thank you very much to the organizers for inviting me to present some of our work in the lab. And our goal is always to get better treatment to the patients, and this organization is doing a tremendous job doing that. So I know you probably can't read it, but I really wanted to show a picture from last night. But these are my disclosures. I do receive funding from Sanofi Genzyme. I'm on the advisory board for the Pompe disease registry that you heard a little bit about. And then I have I'm the PI of the registry at UC Irvine. So the rationale for our study was, we already have heard over the last couple of days that enzyme replacement does a great job, but the effects wear off after a while. And what I'm showing you on the right is real data that we published a few years ago from our 18 patients that we followed. Only one patient had sufficient data to look at the trajectory prior to ERT, so the start of all of the other data, where the red line starts is the start of ERT. And you can see that there is a hump where there is improvement, and then there is gradual decline thereafter. And this was, on the left is one of our patients who at age 17 had a muscle biopsy, and this was after 5 years of ERT, where he's still showing a lot of a glycogen accumulation. And on the right is published muscle showing not only the glycogen buildup, but the autophagic accumulation, which may have a big role in the continued decline of muscle function and the accumulating pathology that we see. So why did we choose glycogen synthase? Glycogen synthase catalyzes the addition of glucose residues to the growing molecule of glycogen, and it does that by formation of these 1,4 glucosidic linkages. And we know that glycogen 1 synthase has 2 isoforms. The one in the liver is really important. You don't want to target that, but you want specific inhibitors for glycogen 1 synthase. This is not new. Dr. Rabin and her group published this almost 2 decades ago, where they looked at short pin RNA sequences, and they got that into the muscle using AV, and then they looked at how much glycogen synthase was downregulated and the effects on glycogen, and they found significant improvement, about, quite read my slide, but it's 62% reduction in their papers that are referenced below. What you see there with the big X is where Pompe patients are deficient in their GAA enzyme, and as a result, glycogen doesn't get broken down. It accumulates in the muscle and other organs. What we're targeting is glycogen synthase upstream of that. So by targeting it, you're reducing the glycogen, and therefore whatever residual enzyme the patient has can address that reduced substrate load. So what we've done is we've partnered with Ionis, and they have developed antisense oligos targeting glycogen synthase 1, the muscle-specific glycogen synthase. And then ASOs are strands of DNA which attach to complementary RNA, and then once it attaches by various processes, RNAs, H1-mediated messenger RNA degradation, or you can alter the splice mutation, as is addressed in spinal muscular atrophy very successfully. In this disease, we want to reduce the glycogen synthase and therefore reduce the glycogen, and using this as a substrate inhibitor. So starting with 150 oligos, They studied these in vitro and in normal mice, and then gave us a couple of ASOs, which we then studied in our mice. And what you see here is that the Gys1 is effective in the muscle, but not in the liver. So Dr. Rabin kindly gave us her wonderful knockout mice. So they have no enzyme, so they're like an infantile onset model, but they do develop their disease later on. So around 6-7 months, they develop weakness. And on the right, you see is what we did in the lab studying these mice. They're homozygous, and you can see we did a lot of work, and they show a steady decline. And on the left is the amount of glycogen that is increasing as the mice is getting older. So this is the outline of our experiments. We started with 1-month-old mice, which represent infantile, juvenile onset, perhaps at a dose of 25 milligrams per kilo per week, subcutaneously, times 16 doses. And then in another cohort, 3-month-old mice, which could represent adult onset, only the ASOs. In cohort 3, older adults with ERT, and then in cohort 4 we're targeting really early disease at P4, so 4-day-old mice with ERT. And some of that work has been presented already at the World Meeting and more recently at SIMD. So this is the strategy for cohort 1, where we started with big numbers, and then we tested 2 different doses against PBS, which is just water, and then a mismatch ASO, so it's a control ASO, and then we sacrifice them, and we measure the messenger RNA, the protein of Gys1, glycogen, and then some other markers of autophagy that you see here. So I'm apologetic because you probably can't see this very well, but let's see if we can work through it together. So is this the pointer here? Oh, so I have to point there. Okay. So yeah, what you see, actually, I can't see that, but the right at the top is the strategy, and then on the left is the messenger RNA, and you see that the ASO1 and ASO2 reduce the messenger RNA, and then on the right is the protein, so that you test that by Western blot analysis, you see that the ASOs are very effective at knocking down Gys1. And then on the bottom right is a PAS stain. It's you just take a section of muscle and then you look at PAS, which is a marker for glycogen, and you can make out that PBS and control are not reducing the glycogen as much as the ASOs. And then on the left bottom is a calorimetric assay where you're doing biochemical analysis of the glycogen levels. So it shows that the ASOs against Gys1 are improving the glycogen levels. So in this cohort 2 I mentioned was older, so adult mice, and we did pretty much the same thing. What you see is also very similar results with the Gys being knocked down both by messenger RNA and protein, and then on the bottom you see that there is reduction of the glycogen. The control we found also had a little bit of an effect, but not as much as in the Gys1 targeted antisense oligos. So in this cohort, we looked at, because there was still residual glycogen accumulation with just the ASOs, because these mice have absolutely no enzyme whatsoever. We studied the effects of both the antisense oligos as well as enzyme replacement therapy at the same dose that patients received, 20 milligrams per kilo. And so that's the strategy at the top, and this is rotarod. So we weren't as kind as the previous investigators who were protecting these mice from dropping onto the platform. So they basically walk on this rotating wheel, and then you time when they drop. So we looked at that, and there was improvement with the Antisense oligo-treated as well as the combo treated. So we started with oligo that you see there, and then we added the enzyme replacement therapy. It's a little of a technical challenge to find a tail vein and inject them, so it's done at a little older age. And then you see very similar results over there with the knockdown of the GYS and then knockdown of the glycogen, as you see over there, and then reflected with the PAS stain in the actual muscle itself. So this is a summary of a reduction. You probably can't see it too well, but what you are asked to see is that there was pretty significant reduction of the GYS1. There was also reduction of the glycogen levels, not so much with just the ASO, and therefore we proceeded to study the ASO in combo with the enzyme replacement therapy. So this is a toxicity slide that I showed for cohort 3, but very similar results in cohort 1 and 2. And what we are seeing here is the weight, the body weight, so there was no significant differences. Organ weight, no significant differences, and these are liver function tests, and we also looked at BUN and creatinine, which reflects kidney toxicity, and that's for liver toxicity, and there were no significant differences. We do see elevated liver function tests in the untreated, PBS-treated mice. So yeah, we were very happy that we didn't see toxic levels either in the kidney or the liver. So these studies that we did were almost exactly mirrored by Dr. Ullman's group, who published earlier this year in January their study using the maize small molecule. It's not an antisense, it's just a small molecule targeting GYS1. And what you see here is the very elegant work looking at the differences in the glycogen accumulating machinery between the wild-type mice on the left of each bar and the Pompe mice. And you can see that there is upregulation of glycogen and GLUT1 and so forth. So we know from previous studies as well that in Pompe disease, that there is upregulation of the formation of glycogen, and once you give the enzyme, it actually reduces this entire machinery that's revved up in Pompe disease. And then they proceeded to study the effects of maize 101, MZ101. And what you see over here is their studies looking at different doses, different times, and you see that there is improvement in the GYS1 levels and also improvement in the glycogen levels. And yeah, I can't quite see these slides very well, but yeah, so this was, oh, and then on the right here, you can see that they looked at not only their small molecule inhibitor, but they combined it with enzyme replacement therapy. And the results are really quite spectacular, that they're seeing very significant glycogen reduction with the combo, as did we in our results. So in conclusion, ASO treatment is a safe therapy. We see evidence of very low toxicity. We looked at other doses. We found that the best dose was 25 milligrams per kilo. We think overall that at least in this mouse model, where there is no innate GA activity, that you need the ASO and the enzyme replacement therapy in patients. However, it's a different story. Maybe these ASOs might be sufficient because we know the adult onset patients do have a significant amount of enzyme that they're producing. We also propose that the earlier the better, before the accumulation of glycogen, before pathology has developed, because it's hard to reverse what you've lost. The recent studies by Ullman that I presented really corroborates what we have shown. Our future plans is to complete our trial. We're doing the neonatal cohort that we're building up the N. We had to build up our colony. We also are interested in looking at the effects on the central nervous system, which is significant in Pompe disease. And we hope that there will be a clinical trial in the future. And that's it. These are my acknowledgements. Members of my lab, funding agencies. Thank you, AMDA, for funding our initial research, and that led to an R21. And I'm hoping that there will be greater funding, and then our collaborators at Ionis and Nina, now I know is at M6P, and local collaborators in the Department of Neurology. Thank you so much.